Thyroid cancer is a malignant tumor that develops in the thyroid gland located at the base of the neck. It is the most common endocrine cancer. The papillary carcinoma is the most frequent histological type, accounting for approximately 70 to 80% of thyroid cancer cases. This type of cancer is often associated with thyroid nodules, which can be detected during routine medical examinations or when investigating clinical symptoms. Diagnosis of thyroid cancer relies on clinical evaluation and additional investigations. Ultrasound is essential to locate and assess thyroid nodules. Fine needle aspiration, cytology, is a key examination to confirm the diagnosis. A sample of cells is taken from the thyroid nodule for histopathological analysis, which determines whether the cells are benign or malignant. Treatment of thyroid cancer is primarily surgical, and it varies according to the tumor's histological type. After surgery, radioactive iodine therapy may be administered to destroy any remaining thyroid cells. Follow-up is an important step after treatment. Although thyroid cancer generally has a favorable prognosis, there is a risk of recurrence, so lifelong monitoring is necessary. Thyroid cancer remains a relatively rare disease, accounting for approximately 1% of all cancers. However, its incidence has been increasing over recent decades. It can affect individuals of all ages, but they are more frequent at the extreme age ranges, particularly in those under 20 years old and over 60 years old. Overall, thyroid cancer shows a female predominance, with women being more likely to develop the disease than men. Several risk factors are associated with the development of thyroid cancer, including environmental, genetic, and medical predisposition. Iodine deficiency, one of the main environmental factors associated with an increased risk of thyroid cancer, especially in regions with insufficient salt iodization. Iodine is essential for thyroid hormone production, and a deficiency can lead to abnormalities in thyroid function. Previous cervical irradiation, for example, as part of treatments for cancers in the head and neck region. Ionizing radiation can damage thyroid cells, causing genetic mutations and promoting the development of thyroid tumors. Certain thyroid pathologies, for example Hashimoto's thyroiditis, an autoimmune disease in which the immune system attacks the thyroid gland, is associated with an increased risk of developing thyroid cancer. Genetic factors, a family history of papillary thyroid cancer, can increase the risk of this form of cancer. Medullary thyroid cancer can be hereditary, particularly in the context of multiple endocrine neoplasia syndromes. These syndromes increase the risk of developing medullary thyroid carcinoma, as well as other endocrine cancers. Individuals with a family history of such syndromes require close monitoring for early diagnosis. The anatomopathology of thyroid cancer allows tumors to be classified according to their cellular origin and behavior. Thyroid cancers are mainly divided into two broad categories: epithelial tumors and non-epithelial tumors. Epithelial tumors, these are the most frequent and originate from thyroid gland cells. They can be derived from follicular cells or C cells, which produce calcitonin. Derived from follicular cells, these represent the majority of thyroid cancer cases. Differentiated carcinoma. This type generally has a favorable prognosis, especially when detected early. It mainly includes two subtypes. Papillary carcinoma, the most frequent type, about 70% of cases, usually well differentiated and slow growing. Follicular carcinoma, less frequent than papillary carcinoma, but also a differentiated carcinoma originating from the follicular cells of the thyroid gland. Undifferentiated or anaplastic carcinoma, a highly aggressive carcinoma that is difficult to treat. Prognosis is very poor, with short-term survival due to rapid tumor progression and treatment challenge. Derived from C cells like medullary cancer. This cancer arises from thyroid C cells, which produce calcitonin. It can be sporadic, isolated, or familial, the latter often associated with multiple endocrine neoplasia syndrome, a genetic condition predisposing to multiple types of endocrine cancers. Non-epithelial tumors are much rarer and include several types of tumors that do not originate from thyroid epithelial cells. Sarcomas. These tumors arise from connective tissues such as muscles or blood vessels and are extremely rare in the thyroid. Lymphomas. Although lymphomas are cancers of blood cells that primarily develop in lymph nodes, they can occasionally affect the thyroid. Metastases. Cancers spreading to the thyroid from other organs are also rare but can occur.